the most important thing for us, and we've seen it over the last 8 months of how that has really helped us to manage and flatten the curve. And of course, behavioral change again. How do we continue to make sure that the people who have the responsibility to follow the basic rules, and if we get that right, we know we've flattened the curve. But of course, on the back of that, we've also got to have a look at those that are not. And part of that consultation and report back, we have many reports on places where people are not adhering to the rules, whether it be in bars and pubs, whether it be in public transport, whether it be in business spaces, where people are not adhering to the rules, wearing their masks, following social distancing, sanitizing, getting those basic principles right. We are going to have to step up when it comes to law enforcement. And in this space, specifically in the hotspot areas, you will see lots more focus in law enforcement. When I say law enforcement, it is not just up to the police, it is up to the roles that law enforcement as a whole plays. So it's the South African Police Service. It is our law enforcement officials, and you would have seen already a number of operations and activities happening across areas where those numbers are going up, where we are zooming in with these law enforcement officials. It is about our liquor inspectors moving in to have a look that businesses are following the rules, that customers in those businesses are not being those super spreaders, the traffic officials. It is our summer season plan, using our traffic officials, using our beach monitors, using our bib-wearing people that we've put in place across the province. These people that have been deployed will be moving into those hotspot areas and already have started. It's how lifeguards over the summer season are going to be acting. If you think back to any major event that's taken place in our province, if you think back to the World Cup and how we really did all stand together to make sure that we had a safe World Cup, to make sure that we had mechanisms to deal with any space that was going to be putting us at risk. And if you remember at that stage, it was amazing to see how law enforcement and city officials and citizens, neighborhood watchers, you name it, all got together to make it a safe World Cup. We will see exactly the same kind of reaction. Those in the garden route, think back to the fires of the garden route, and think back of how everyone zoomed in, from firefighters to law enforcement to citizens, who all stood up and got involved to make sure that we put out the fires. We're going to be seeing exactly the same thing. We're moving into the garden route, making sure that we are flattening this curve, putting out this big bushfire that is COVID-19 spread, especially now during the summer season. We've got to make sure that we are all committed over this month of December, the next 30 days. Let's all make sure that we play our part, that we focus. If we follow these three areas, we know that we will, and this is just about applying the basics. We will, at the back of it, as government, be doing our part, and we need to, as we've said before in this deal, make sure that citizens play their part. If we all do this, it is not going to be just life as normal. It is going to be the new normal. But we all play our part in this new normal. We will manage to flatten this curve. We will manage to have our summer season. We will manage to keep our economy open. We will manage to do all of this. And that is exactly what this focus has to be. That is what we will see now from the health response. That is the response that we will also be sending to the president for next week's PCC decision. Because obviously at the end of the day, the decisions around the level 1 lockdown or the level 1 restrictions, those are national government decisions. We are consulting. That's what the visit to the garden route tomorrow will be with the minister, and of course our meeting this morning and yesterday. It's all continuing the consulting. We as citizens of the Western Cape must show that we have got this, that we are managing the curve, that we are managing this virus in these hotspots. We've done it before, we've done it regularly, and this one again, we've got to show that we've got this in hand. This is about a deal between the citizens of this region, and specifically in those hotspots, and us as government, all three spheres of government. Let's work together and let's make sure we continue to flatten this curve. You will see in our health response as well how we are innovating and really upping our game here as well. This is a world-class response, And of course, we've got to make sure that we all do this in sync and in tune. It is up to you, the citizen. You have the power. And of course, we will be there to help you along the whole way. Thank you very much. Bianca, back to you.
Thank you very much, Premier. Up next on the program is Minister of Health, Dr. Norma French-Mbombo. Minister Mbombo?
Yeah. Thank you. Just to start where Premier left off, Garden Route, where we have seen numbers has been increasing, and also the city of Cape Town. I think I have to reiterate and strengthen that the behavior of individuals, the communities, it is the one that actually will determine where we go when it comes to the extent where we go when it comes to the epidemic. Whilst people always ask us whether we do have enough beds, they must understand that the whole of the health system depends on the healthcare workers. So in the midst that we are talking about the COVID, when the team is presenting our strategy in terms of the 5-point plan, you'll find that the reintroduction of the non-COVID services and also the state of our mental health state and psychological and physical wellness of our workers, healthcare workers, it's important. However, when we have so much of the increase in our numbers, it will have an impact on the health system. No government, no healthcare professional can be able to ensure that all of these interventions are happening. So that's why we call on everyone to take their responsibility. Now we are on the 16 days of activism against the violence against women and children, including the femicide. Violence gets absorbed by health system. We just coming from the first World AIDS Day on the 1st of December. The HIV/AIDS program is one that also was impacted in regards to, as part of the non-COVID services, where we took a dip because of the initiation of the first treatment. So it's another pandemic. We are in the space where we have got the issues, especially during the festive season, of the interpersonal violence and also on the road accidents. And also that will be absorbed by health. We are talking about the issue of the influx of the people coming or even going, where even some of them will be left behind, especially with the older persons who also have got chronic conditions, where we do know from our experience, these are the people who normally call for ambulance at 2 a.m. when they've got complications from their chronic conditions. The point that I'm trying to make, all of these have to be absorbed by the healthcare workers. They are tired, they are physically and mentally drained, taking note that they've never stayed at home. They've been working ever since we had the outbreak. So when people, especially those who intentionally misbehave to such an extent that they become super spreaders, or despite that you are talking about all the interventions that needs to be done related to the behavior, they are the ones who ended up having increase in these numbers. They must know that it's not only affecting themselves and their families, but it means that we'll end up having long queues, even in our primary healthcare clinics. When people now, those who are not admitted, don't need admission to the hospital, will end up clogging the system. In addition to the 1,000 plus of those that are occupying our beds, all of these have to be absorbed by the healthcare worker. So my message is the 3 C's, which is the avoid the crowds, the contact setting where 1.5 meter distance in regard to the physical distancing, avoid the confined spaces, avoid the areas where there is poor ventilation, and lastly, the golden rules in regard to the keep on masking up, sanitize your hands, don't touch your face, supermarket etiquette, because now there will be the season for the shopping. Make point that when you do the shopping, you adhere to the protocols. And lastly, for the businesses, where they must avoid a situation of the gatherings within their spaces, and also they have to stick to the occupational and health and safety, which is what we are doing in our health system, where we provide the whole packages of the psychological and also the physical well-being of our staff. So tomorrow we are joining the National Minister of Health in the garden route, where we will meet with the whole of the stakeholders there, inclusive of all the mayors from the garden route and also from the health team and other stakeholders, because at the end, whilst we are responsible for the health services, but health is everybody's business. But let's not forget healthcare workers as actually the pillars that strengthen the health system, because without them, you can have as many beds that you want to have. We can't be able to have as many people we can accommodate elsewhere in our health system. But if now they all have to, some of them have to be on quarantine for the 10 days or isolation for the 10 days, also even their families that get affected, it means that we'll end up not having a health system that can be accommodative. So it is in your hands. Mask up. Thank you.
Thank you very much, Minister. The health presentation is going to be done by Dr. Keith Kuti, as well as he'll be joined by Professor Mary Ann Davies, who will be co-presenting with him. Dr. Kuti.
Thank you very much, Bianca. Thank you, Premier. Thank you, Minister. Bianca, can everybody see the slides?
I can see them on my side.
Thank you. Good morning to everyone. Me and Professor Davies will share this presentation. We will give you an update of where we are at the provincial level, at district level, what is happening in the garden route, and then an update on our health system recovery and our 5-point COVID resurgence strategy. And then we will do an update on what the latest evidence and science is telling us about COVID transmission, and what is the evidence-informed messaging that we should, and practices, behaviors we should practice to curb the spread. So just from a provincial perspective, this is an update right up until the 30th of November. And you will then see what we had towards the end of June was our initial surge of cases. What we're seeing up until the 30th of November is now an established surge of cases in the Western Cape. What that goes with is an increase in cases, an increase in hospitalization, an increase in the oxygen use, and this is all consistent with an ongoing established resurgence. If you look at the provincial overview, the province as a whole continues to see a big increase in cases. When we look at the test positivity rate for tests, we are now above 20%, where we were 16% a week ago. And we are now starting to match the levels we saw about the third week of May in the first initial surge. Hospitalization now shows a continued increase, and then also an continued increase in deaths. If you look at the growth in cases based on the national reported case numbers, you will see that the percentage is just under 50%, it's about 49%. Our local data, which is slightly at different time frames to the national data, is 42%. And what it basically means is week on week, which is the week that we report here, the 25th of November, the 7 days that came to the 25th, and then the 7 days that came to the 2nd of December. There's been an increase of 41% increase between the number of cases in the rolling 7-day average for that time. The reproduction number is what is the number of people that every positive case infects, and at the moment in this province is running at 1.4. So for every case we currently have, there's 1.4 other cases that we currently cause. Anything above 1 means an increase in cases. The whole object of what we're trying to do is to get that to equal 1 and then to drop below 1, because once you drop below 1, you have a decrease in cases. This is a rapid increase in the hospitalization, both in public sector and private sector, and also ICU, public sector and private sector. This is the hospital admission by health district. You'll see a sharp increase. The left bottom is the garden route. So we've had more admissions in the garden route this time around than in the first surge. And you see the increase in the metro now taking up. Whereas in the other districts, it's relatively stable. Overberg possibly coming up, but it's much lower numbers in Overberg. The mortality is, our reported deaths per day is starting to increase. And this is the MRC report. This goes up until the 24th of November. So you see it's about a week behind. We expect the report that's coming out next week to show an increase for this week that we're in. And we expect this increase of deaths to be going upwards over the next couple of weeks. And this is just an update on our public sector testing. We reported last week that we do roughly about 10,000 tests a week in the Western Cape, both in the public sector and then 10,000 in the private sector. This last week, our tests in the public sector has increased. So we saw 14,000 tests, and looks like it's going to be an upward trend for the next couple of weeks. Our capacity, we're still way within our capacity for testing. And then the more concerning one that comes out now is because as cases increase, the cases amongst healthcare workers also increase. So we have now seen that the cases for healthcare workers in September, October was as low as 5 cases a day for the whole province. We have seen a peak in the last 2 weeks of 38 cases in one day, but it's an increase of number of cases amongst healthcare workers. And I will give a little bit more detail of what that picture looks like. This is a bit of a busy slide, but what we're showing here is we're currently tracking the top 20 facilities with cases. And we're showing you the cases over the last 5 weeks actually, per area. And you will see hospitals like Grootske and Tygerberg, because they are the biggest hospitals with the most staff, have in the 5-week period the most new cases amongst healthcare workers. Tygerberg with 30, Grootske with 28. But if you look at the hospital in the Garden Route, like George Hospital, has had 26. Now, George Hospital's got significantly less staff than Grootske and Tygerberg, but 26 cases in the last 5 weeks. Followed by Mossel Bay Hospital, and then you can see Knysna Hospital, and then some of the other metro hospitals that has more staff members. The picture here is one of that the healthcare worker infections mirrors the infections we see in the communities where the healthcare workers live. So it is the same picture of community increase in cases that we're seeing in healthcare worker increases. I'm going to hand over to Prof. Davies from this point on. Marianne?
Thanks very much. So I'm going to talk a little bit about a closer look at what we're seeing in the different districts in the province. Here we're looking at the number of active cases that we've seen over time. On the left-hand side, summarized into province in blue, metro in red, and rural in green. And you can see that we are seeing increases in all of those areas. The middle slide shows the metro, and again, you can see increases in the active cases really in all areas. And on the right-hand side is looking at our non-metro areas, clearly the biggest increase in the Garden Route, but we are starting to see increases in Cape Winelands, in Overberg, and although the numbers are a lot smaller, also in Central Karoo. And what I want to highlight is that when we've got that many active cases in the community, those are people who have the capacity to spread the disease. And so the more active cases that we know are around, the more likely it is that we are going to come into contact with an active case and result in greater spread. So as we see those active cases increase, we really need to be thinking about a risk-adjusted strategy to our behavior, because our chances of being in contact with an active case are greater. If we can go to the next slide. This is looking in a little bit more detail at the cases in the metro as a whole in the middle, and then for each of the different sub-districts. And really you can see that for every sub-district we've had at least a 30% increase in cases in the last week, and for some of them substantially higher than that. And since our low point in September, a nearly 500% increase in our number of cases. The next slide. This is looking at the rural districts, very similar picture, 750% increase since our low point in September. What I want to highlight here is that particularly for the garden route, the increase might not look that big because it's only 29%, but the axes of these graphs are different. So look at the number of cases in the garden route. We're talking about reaching nearly 400 new cases in a day. In the other areas where we might see some very big percentage increases, that's because the original numbers were low. But again, we are seeing really increases across several of the rural districts, particularly Garden Route and Cape Winelands and possibly Overberg, and some small number increases, but certainly increases in Central Karoo. We can move on. So we continue to have almost daily surveillance huddles where we track what is going on and figure out the best way to respond to this. Key things that we have noted is very sadly that a staff member has passed away, and this is what we particularly want to prevent because this has very long-term consequences on our health service. We also highlight where there are events that may be concerning and that may lead to spread of cases, and try to have a presence so that those can be safer, but also to follow up if there is a risk of cases following those events. And then in the Cape Winelands, we've noticed a number of workplace clusters where we are providing support and also working in a whole of society way to bring our community-based services and NGOs on board, our law enforcement, as well as environmental health practitioners, and actually identifying the specific streets where there are lots of cases and intervening in those areas. We can move to the next slide. And again, we continue to monitor our wastewater, part of the world-class system that we have in place. This has now been expanded not just to the Metro, but also Breede Valley and the Theewaterskloof area. For today, I'm just going to show the Metro results. And what I want to highlight is that we don't really have any of the very light blue areas left in the Metro. So we're seeing that the SARS-CoV-2 RNA has increased across the Metro by 24%, that really every area is now affected, and that in certain of the effluent plants that the wastewater really has increased. And this is very useful because it doesn't rely on people coming for tests or developing symptoms, and it's kind of a way of getting the temperature of COVID in the city and seeing that that temperature is rising. We can move on. So now I'm going to just focus in the next few slides on the garden route in particular. And as Dr. Kluti highlighted, we're now seeing more cases with a steeper increase than we did during our first wave. We're also seeing more hospitalizations, and the deaths are at least approaching as much as we saw in the first wave. These slides suggest a hint of a decrease, but we have also had challenges with some delayed test results, so we need to watch that very closely and see what happens over the next few days. We can go to the next slide. Here you can just see the number of cases. This is data from Monday. The increases every day, so these are all cases that need to be traced and have all their contacts quarantined. We can move on. The garden route has a very active containment strategy, which really works across both the whole of the health system, but also the whole of society. Knowing what's going on, how we respond, finding all the cases by intensified screening and testing, and ramping up our contact tracing capacity to respond to all of those cases, having communications and a multi-sectoral response to try to slow down the spread, and then increasing our hospital capacity to deal with the consequences of infection. What's very exciting in the last week in the garden route is that we've started antigen testing, which is testing for active virus, but it's a test which can be done on the spot at the point of care, and you can get a result within an hour or two. And so that's very useful for identifying our most infectious cases and for being able to respond really quickly, particularly in outbreak situations. So we're very excited to have started that so that we really can identify clusters and respond quickly. We can move on. The garden route also does a daily huddle. I won't go into the detail, just to highlight that we're identifying areas where we're seeing lots of cases. We're identifying the characteristics of those cases, like the age groups in Mossel Bay. We're closely monitoring our hospitals and particularly our staff in the hospitals. And you can see a number of
up for. That's crucial. How much participation had we enabled for the residents of our municipalities to be part of an inclusive process rather than being top down, coming with solutions as policy experts, as lawyers who understand the legislative framework. Participation is critical. And then she asked about accountability and whether or not we had done right by South Africans, those who are in positions of authority within the cities, to make sure that there is the requisite levels of accountability. And I think, truth be told, the answer is probably a mixed bag. And when you talk about accountability, you cannot leave out, as she rightly did, the question of corruption in particular. Very often the largesse that is dispensed to local government is an opportunity to do good. It's also sometimes an opportunity for certain kind of nefarious relationships to open up between politics and money. I thought it was really interesting hearing the minister talking about the importance of us also asking some important tough questions around corruption and whether or not that had been dealt with adequately. So those are just some of the questions which very often those of us as analysts, as journalists, as writers, as commentators throw at the politicians. And I think it is really, really fantastic to hear a senior cabinet minister asking those questions as a form of self-accountability of the government, and to ask us in turn as citizens and as the members, the delegates present for the next 2 days, to also highlight those questions as we are asking whether or not local government is as effective as it can and should be as a matter of constitutional duty in terms of what local government is supposed to deliver to each one of us far and wide across the length and breadth of South Africa. So those are just some of the takeaways for me from the minister's address. I'm going to ask you to, wherever you are watching from, to just be a little bit patient. These things happen, and hopefully within the next minute or two, we will have that feedback. We did see the president just a minute ago, so we know that the president is present. Don't worry, he hasn't run away. And as soon as, why are some of you laughing? I'm not subtweeting anyone. As soon as we have the president ready, we will in fact hear from him. In fact, the president is laughing. I don't know whether he is ascribing thoughts to me that I wasn't having. Good morning to you, Mr. President. It's always an honor to speak to you and engage you. This morning, I'm not going to engage you, but it is an absolute pleasure to welcome you to this space. And the floor virtually is all yours. Thank you so much for your patience. We really appreciate it.
Well, thank you very much, Program Director. It's always a pleasure to listen to you and the way in which you analyze issues and matters. Minister of Cooperative Governance and Traditional